The unfortunate truth about mental health and mental illness is that people don't seek mental health treatment until it's almost too late. When a person comes in, they usually come in crisis. And while we're very equipped to handle people who are in crisis, that's not primarily what we do over the longer term. What we do try to do is help a person understand preventive care over crisis management. Certain mental health disorders are worsened if you wait too long. So there are some serious mental illnesses such as schizophrenia or bipolar disorder that if we delay, there can be really negative ramifications and very destructive to a person's life. And so we want to be able to intervene earlier rather than later after the fact, especially for people who are suffering from these disorders. People oftentimes delay seeing a therapist because they may not have the right time that they believe is the right time for them. But if you're curious about understanding yourself, if you're curious about how it is that, your life leads to certain problems, and maybe curious about how you could cope better in terms of stress and even times of distress, then therapy would actually be a really good start. We as a society have changed and shifted to a more accepting way of looking at mental health and mental health care. And so one of the things that I encourage people to do is keep talking about it, but also take the courage and maybe establish yourself with a therapist or a mental health provider.